Hey guys, welcome and welcome back to my channel. If this is your first time here, please do hit the subscribe button and the post notification bell beside it so you can get notified firsthand whenever I post a new video. Today I'll be sharing with you guys tips on how to make your clinical posting worthwhile. Without further ado, let's get right into this video. As a student nurse, as a medical student who actually wants to be a medical student, I will actually loves nursing or medicine or whatever course it is you're doing that involves clinical posting, you would realize that clinical posting is like one of the most interesting times ever, and sometimes people can get like carried away and be doing other stuff instead of doing what you're supposed to do as a student nurse or medical student. I'm actually talking about Muslim student nurses because that's what I know of. So today I'll be giving you guys a few tips that I used that helped me rather during my clinical posting. The first thing I have on my list is to make sure to always be on time. Always be on time, not just so that your matron would see that you're always on time or you're doing some competition with your fellow nurses, who will be the favorite student nurse, blah 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 blah. This is more like a discipline for you to like prepare yourself for when you actually go into the world and you start working in a hospital. You actually have to always be on time. So you putting in that effort, because no lecturer is watching you, nobody's watching you, the nurses can't even punish you. So this is just you disciplining yourself, giving yourself that discipline to always be punctual. So try your best to always come for your clinical posting early, whether it's night shift, morning shift, or evening shift, or afternoon shift, whatever. Try to always be punctual because it will help you in the long run to be punctual at your workplace. The second thing I have on my list is to always greet your patients. Always, especially if you're in a new ward, try to get acquainted with your patients. Whenever you come in, go and greet them, talk to them, try to make a conversation with them. If you're a jovial person, then this should be like your place of expertise, right? Try your best, even if you're somebody like me who doesn't like know how to make conversations and stuff like that. Try to involve your patients in conversations. Ask them how they are. If you are coming for morning shift, ask them how their night was. Ask them if they've eaten. If it's a patient that has a wound or something, you ask them how their wound is. If it's a patient that you already know this person's condition, let me say something like a heart condition, you ask them little things about how they feel. Just try to make a conversation, because this would actually help you. Sometimes when I came and I didn't greet my patients or anything, and then when the nurses asked me to go and do something for that patient, it's actually like feel awkward because I came in the morning and I didn't greet this person, or when I came for work I didn't greet this person, so it was actually like very awkward. So I decided to always greet my patients, because it helps the conversation flow more, because you've already seen this person when you came and you're like, oh hey, and you've already exchanged pleasantries and stuff like that. So when you're going to do something for that patient, number one, you will gain the patient's trust, especially if you're somebody with sweet mouths that like won the patient over when you are greeting them when you arrived. It will also make you feel very confident in what you're doing with the patient, because the patient will also feel comfortable with you, and you also feel comfortable with the patient, which will bring about the confidence. You are making any sense? I hope I'm making sense. So yeah, that's like one of the main reasons why you should greet your patients. The third tip I have on my list is to always read files. Remember I said something about knowing the patient's condition while greeting the patients. Sometimes I prefer to actually open the files before going to greet the patients, because that way when you read stuff about the patients and then you go to greet the patients, you actually like see similarities between what you read in the file and some patients, and you'll be like, oh, this is Mr. Koro, this must be Mr. Koro, the person with the broken leg or something like that. So always read files. Another reason why you should read files is so that you can learn. Like that should be the main reason for reading the files, so you can learn different disease conditions, learn about the drugs for those kinds of conditions, learn how to chat and stuff like that. Learning how to chat, like the vital signs, yeah, that's what it's called. I forgot the name for a second. learn how to chart the vital signs, see how it's being charted. You monitor the patient's vital signs. Okay, this person's blood pressure was high at this certain time, then it got normal, and blah 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 blah. Reading files actually teaches a lot, and a lot. So much of what I learned during my clinical posting was from reading files. So when you read files, you jot them down, and then on your own free time, you go to Google. We are so blessed to have Google. I'm speaking like our lecturers, but yes, we're so blessed to have Google at this point, because I cannot imagine what it would be like without Google, where you see like a disease condition and you have to start flipping through one big dictionary just to find what the disease condition is about. Then you get another textbook to see more things about the disease condition. No, Google just made everything easier for us. So yay, we have Google. So whenever you finish jotting at your free time, just like go on to like browse about those things that you read about from the patient, their drugs, everything you jotted down. Make new notes on them and read them at your free time too. The fourth thing I have on my list is to jot things down with colorful pens. Okay, we already talked about jotting down while reading the files, right? So while reading the files, you might not have the time to actually jot down with colorful pens, but while you're doing that research, where you go home and then you read more about the disease condition and stuff, try to use colorful pens to write, because it will actually help to keep your brain very active, and you wouldn't get like so bored easily when you're actually reading them and when you're actually writing it. So for example, let's just say you're using blue and red pen. So try to like find a way to use the blue and the red pen in such a way that it will be fun to read the notes that you make. But if you have other colors of pens, then you can also use them to jot things down and stuff like that. And also try to use highlighters. They actually work very well. The next thing I have on my list is to be observant. Try your best to always be observant. Monitor your patients. Like always be on the lookout. Like always be on the lookout. Notice when a patient's breathing pattern changes. Notice when a patient is being like uncomfortable, like the patient is just tossing and turning. Like that patient wasn't like that before. Why is this patient turning? Then you go on to find out, or you like call a senior nurse, like, what's going on? Why is this patient going like this? What's going on? So being observant will actually help to prevent a lot of damages, deaths, complications, and stuff like that. Always be on the lookout, always be observant, always watch like an eagle. Another tip I have for you guys is to always ask questions. I know I'm using always so much, but everything you're doing, always do it. Always ask questions as regularly as possible. If you're confused about any procedure they're doing, anything that is happening, anything you're reading from the files, ask questions. Don't be scared. You're actually there to learn. So always ask questions, and you'll find out that these nurses are actually waiting for you to ask them questions so that they can teach you. And then before you know it, they've brought out their notebook from School of Nursing or from university, and then they're like giving you notes, and you're like, okay, you had this so much information and you are just holding it. So always ask questions if you're confused. If they are doing a procedure and you're just there watching and you don't know why they did what they did, or what they used to do that stuff, or what they used to stop the bleed, to arrest the bleeding, ask questions. You are there to learn. Okay, nobody would like shoot you, nobody would laugh at you for asking questions. Everybody wants to learn, everybody wants to know. So you asking questions also help your colleagues, and it will also make the nurses happy, because I noticed that whenever we ask questions, the nurses are usually so happy to answer. I've not seen anyone that wasn't happy to answer. They were always so ready to answer, always so happy to answer us. Now I'm going to sound like my lecturers for this one, but it's the truth. It's the truth. Don't form the habit of always checking your time. Like, is it time to go? You doing that would mean like you're not enjoying what you're doing. You're not going through the process. You don't want to go through the process. You don't want to study nursing. You don't want to come for your clinical post. You just want to wear white and snap picture and call yourself nurse. Stop looking at your time. Just enjoy the process. Enjoy your shift. Yes, sometimes it can be very stressful, and you can look at the time sometimes, but don't make it a habit to always be like checking your time, checking the time. Is it time to go yet? Bro, No, don't form that habit, because you would actually find yourself doing it when you start working, and then your patients will be dying. You don't even know what you're doing. You're just looking at your time because you want to go. Like, bro, no, don't do that. Don't do that. The last tip I have here is to always be polite. Don't let your patient's frustration get to you. These people are going through a lot, financially, emotionally, physically. Don't let their frustration get to you. They will always be frustrated. Of course, they are frustrated. Understand why they are frustrated, because these people are paying so much just to be on a bed and to take medicine and stuff, and then they're also going through pain and shit, basically. Even emotionally, sometimes they'll feel down, sometimes they'll feel depressed, and some people might want to like transfer their aggression. So don't like fall for it. It's just a trap. It's a trick. Don't fall for it. Don't fall for the trap. Don't enter the trap. Okay, just treat your patients as kings and queens, like they always tell us in school. Always treat your patients like kings and queens. Don't let their frustration get to you, because they are going through a lot. Yes, we know you're going through a lot, but they are going through a lot, and you've decided that you want to take care of them. So don't let that frustration that they're going through be passed to you. Always be polite to them, even when they are doing some rude shit. Just be polite, okay? Because in the end, if worse comes to worse, and they are like gauging what happened, everybody will be like, the nurse didn't even do anything. She was polite. He was polite. They didn't do anything bad. It's from the patient and blah blah blah. So yeah, I believe if you follow these tips, your clinical posting will be like very smooth, very sweet for you, like a wonderful experience. You would enjoy it and you want to go again. This is the end of my video. If you did enjoy it, please do hit the subscribe button and the post notification bell beside it so you can get notified first time whenever I post a new video. Hit the like button. Tell me what you think about this video in the comment section. And if you have any tip that helps you out in your clinical posting or in your journey as a student nurse, feel free to share it with us in the comment section. Just any tip at all concerning being a student nurse. Just any tip that you feel like every student nurse should know, or it would help every student nurse out there. Yeah, share it in the comment section. That's like our safe place, okay? Our safe place between me and you all, okay? See you guys in my next video. Bye.